The following case study describes how various combinations of billing codes could be employed for a patient being treated for depression in the Collaborative Care Model, or CoCM. It is noteworthy that this case study is not representative of all possible clinical and billing scenarios. Organizations should consult with their leadership, billing office, and compliance officer to determine relevant local policies and procedures. This video was adapted from works created by the University of Washington Ames Center. This case study follows the treatment of Mr. A by his primary care provider, or PCP, a behavioral healthcare manager, or BHCM, and a psychiatric consultant over a 5-month period. But first, let's review some general information about CoCM services and the procedure codes used to bill for those services. CoCM services are time-based and reported as the total amount of time the BHCM spends engaging in clinical activities over the course of a calendar month. Only the PCP may submit claims for services. The BHCM and the psychiatric consultant are reimbursed by the PCP through a contract, employment, or other arrangement. CoCM services begin after the referral is made by the PCP and when the BHCM starts engaging in reimbursable clinical activities. It's important to note that the BHCM and psychiatric consultant may provide other outpatient mental health or evaluation and management services in the same calendar month as CoCM services. However, those services must be separate and distinct from CoCM services and may not count toward the time thresholds for CoCM services. All required elements of the CoCM procedure codes must be performed, documented, and time thresholds met to be reimbursed for services. Also, for the initial presenting visit, the PCP must use the appropriate evaluation and management code. The PCP must also use the place of service code for the location where services would normally be provided for in-person care and treatment. The following are the procedure codes used to bill for CoCM services. These codes are referenced throughout the billing case study. CoCM code 99492 is used for the first 70 minutes of CoCM services during the initial calendar month of an episode of care. This code may not be billed in subsequent calendar months of CoCM services. CoCM code 99493 is used for the first 60 minutes of CoCM services during subsequent calendar months of an episode of care. This code may not be billed in the initial month of CoCM services. CoCM code 99494 is an add-on used for an additional 30 minutes of CoCM services during the initial or subsequent calendar months of an episode of care. This code must be billed with either primary procedure code 99492 or 99493. Also, this code may not be used with CoCM code G2214. CoCM code G2214 is used for 30 minutes of CoCM activities in the initial and subsequent calendar months of an episode of care. The PCP may not bill both G2214 and 99492 in the initial calendar month, or G2214 and 99493 in subsequent calendar months. For more information about the procedure codes used for billing CoCM services, refer to the Texas Medicaid Provider Procedures Manual, or TMPPM, Medical and Nursing Specialists, Physicians, and Physician Assistants Handbook. This case study begins on September 5th when a 53-year-old man, Mr. A, presents to his PCP with a chief complaint of not sleeping enough, headaches, and feeling run down. For the last 4 months, he reports waking up too early in the morning and that he cannot get back to sleep. During the day, he is exhausted and is having trouble focusing when at work. Also, he reports an increase in chronic back pain. so he has been staying at home and has stopped exercising. He reports trying everything he can think of to break out of this rut, but feels like it's pointless and is ready to give up. The PCP administers a patient health questionnaire and asks Mr. A about suicidal ideations. After discussing the symptoms on the questionnaire, Mr. A says that he never thought of himself as depressed before. The PCP expresses confidence to Mr. A that he will be able to improve and introduces Mr. A to the BHCM for further evaluation and treatment. The PCP also obtains consent from Mr. A to engage in the clinic's CoCM program. During Mr. A's visit with the PCP on September 5th, the PCP bills the most appropriate ENM code. For this part of the visit, CoCM and psychotherapy CPT codes are not billable. On the same day, the BHCM sees Mr. A for a warm handoff visit to engage Mr. A and schedules a time for a full intake. The BHCM also enters Mr. A's information into the registry, which is done at the end of each encounter between Mr. A and the BHCM. For this part of the visit on September 5th, the BHCM records 20 minutes of CoCM activities, 15 minutes for the visit, and 5 minutes to enter information into the registry. On September 8th, the BHCM conducts a comprehensive assessment of Mr. A and learns that he has been more irritable at home with his wife and children for the past 6 months. He has also stopped going out with friends, and in the last 2 weeks he's been late to work 4 times because he can't get himself started in the morning. As part of the initial comprehensive assessment, the BHCM administers screening instruments for post-traumatic stress disorder and bipolar disorder, both of which are negative. The BHCM also screens for alcohol and substance use disorder using appropriate questionnaires. The results are negative, but Mr. A endorses smoking cigarettes again. The BHCM and Mr. A discuss the provisional diagnosis of major depression and its treatment, as well as the connections between depression and chronic pain. During the visit on September 8th, the BHCM spends 45 minutes with Mr. A and 5 minutes entering information into the registry. For this visit, if eligible for reimbursement, the BHCM has the option to either bill CPT code 90791 for the initial intake appointment, record 50 minutes of CoCM activities, or bill 90791 for the initial intake appointment and record 5 minutes of CoCM activities. If the BHCM does not have independent billing capabilities, they must record 50 minutes of CoCM activities. The next day, the BHCM and psychiatric consultant discuss Mr. A's presentation during weekly case review. The PCP asked whether fluoxetine could be appropriate for Mr. A, but the psychiatric consultant suggests bupropion as an initial antidepressant given its efficacy for treating depression and smoking cessation. A titration schedule is provided to escalate the dose to the therapeutic range and monitor the response with a health questionnaire over the next 4 to 6 weeks. The psychiatric consultant completes the recommendation in the electronic medical record and alerts the PCP to the recommendation through electronic messaging. On September 9th, the BHCM spends 5 minutes preparing for the weekly case review, 10 minutes consulting with the psychiatric consultant, and 5 minutes completing the registry. For these activities, the BHCM records 20 minutes of CoCM services. It's important to note that no psychiatric consultant time is counted toward CoCM activities. On September 16th, the BHCM meets Mr. A for another session. The BHCM initiates problem-solving treatment to target Mr. A's goal of re-engaging in work and social activities. After a productive session, Mr. A agrees to meet by phone in 2 weeks. On September 17th, the BHCM organizes a discussion with the PCP to review the psychiatric consultant's recommendations for antidepressant medication and to discuss the recent initiation of problem-solving treatment. Additionally, the BHCM asks the PCP to follow up with Mr. A on his progress during their next visit. On September 16th, the BHCM spends 30 minutes in a visit with Mr. A and 5 minutes completing the registry. For this visit, if eligible for reimbursement, the BHCM has the option to either bill CPT code 90832 for psychotherapy services, record 35 minutes of CoCM activities, or bill 90832 for psychotherapy services and record 5 minutes of CoCM activities. If the BHCM does not have independent billing capabilities, they must record 35 minutes of CoCM activities. On September 17th, the BHCM spends 5 minutes coordinating care with the PCP and 5 minutes completing the registry. For these activities, the BHCM records 10 minutes of CoCM services. The PCP sees Mr. A on September 25th for a follow-up visit and prescribes bupropion SR 150 mg daily. The PCP reinforces the role of the BHCM in coordinating care and the value of problem-solving treatment for depression. The BHCM calls Mr. A for a scheduled phone visit and administers the health questionnaire and records the score as 16. The BHCM checks in with Mr. A about starting medications and to reinforce problem-solving treatment skills. For the September 25th visit, the PCP bills the most appropriate E&M code for a face-to-face visit. Since the BHCM was not involved in the visit, there are no billable CoCM activities. On September 27th, the BHCM records 10 minutes for the call with Mr. A and 5 minutes for completing the registry. For these activities, the BHCM records 15 minutes of CoCM services. Mr. A has been engaged in care, a diagnosis was established, and treatment was started. During the month of September, the PCP billed 2 visits using the most appropriate E&M codes, and the BHCM recorded a total of 150 minutes of activities. BHCM activities were billed using one of the CPT code combinations shown on the screen.